Welcome to Mountain Mama's Assistant Guide Trainings. Today's training is on head injuries. And we get, as always, our first aid information from this book. It's the Backcountry First Aid and Extended Care by Buck Tilton. It's the abridged version that we have in all our first aid kits. And it's taken from the Wilderness First Responder course that we have all our lead guides take. So you assistant guides and lead guides who also just need a refresher, and all you other women that are here and that want to watch and get a little brush up on your first aid are totally welcome. And then this book is in every first aid kit that we carry for Mountain Mamas. So if you ever had questions, you can get all this information as well at your fingertips in the field. But it's helpful to have some information before you go to kind of have a heads up, as it were, before you head out in the mountains and kind of know what's going on first. So today's head injuries. First, before I want to get into too much, I want to let you know I'm a nurse and I do home health and hospice. So I have some experience, but not an ER trauma nurse or anything like that. So I've got some things. So I'll share with you some of my experiences as well, but basically we'll go off a lot of this book as well. For head injuries, a lot of times we're going to go with we'll start from very mild head injuries. A lot of things we might see is a woman just trips and falls in the mountains and gets a laceration on her head anywhere and just starts bleeding. And of course, with all head injuries, they bleed like crazy. So we're going to want to apply pressure with a clean dressing and hold that. I would hang out with them for 10, 15 minutes until that really stops bleeding. And you can get in there and kind of check to see how severe this is. Now, if this is just a superficial laceration, which most of them are, the bleeding is going to calm down in about 10 or 15 minutes. And when it first starts happening, if you don't apply compression, it just goes everywhere and it looks like they've been mauled or something like that. But if you're able to apply pressure and things like that, you can get it under control. Sorry, that's a little crazy hair there. And I usually just apply dressings and then when it stopped bleeding mostly, as soon as you can get it to stop bleeding, you can essentially the blood actually cleans out the wound. So that's very helpful. So you want to clean that area around that wound, dry it off as best you can. And if it's like a forehead or somewhere where it's bare skin, you can actually just take, we have steri strips, which are these long little pieces of tape. And then we also have Band-Aid dressings as well that you can put either one of those, and you essentially put it on both sides and with the incision in the middle. So it keeps those two sides of the skin coming together. And that's pretty much all you'll need to do if the bleeding has stopped. And then they can hike out on that. They're probably good on that, honestly, unless they need cosmetic surgery or something like that. But, generally you could just keep that on and be good for a couple of weeks and it's healed and you're fine. Some other things, if you're worried if it seems a little deep or a little long, someone's going to want to get stitches maybe. But I've had patients who've had them down to the skull and we've just put tape on it and called it good and they were fine. So, but that's a hospice nurse. So, the other ways you can take care of things, and it's in the hair area, that's always a frustrating area to do any sort of bandaging. It's not going to stay. It's really frustrating. So there's a couple of schools of thought on this. You could try and cut some of that hair, which is really tricky. You can try and use we have liquid bandage or super glue, can get in there and try and bring stuff together, though they're going to have a chunk mat of hair that is just not going to do much after that. You could do super glue on a laceration here or here, anywhere else with skin. They're a little messier, but it's possible if that's all you've got in your kit. What we think is really cool in the hair region, if you have braiding skills, is you can actually take the hair from both sides of that laceration, braid them together, and that braid, if it's a really tight braid, will actually bring those pieces of skin together enough to provide a decent, bandage, I don't know if you want to call it suture, hair suture. Anyway, so those are some thoughts on how to, with simple lacerations to your skull. When we get into more things like today, we're going to talk about mild head injuries and severe head injuries. This is when that little gash has become a little bit more severe. So with the mild one, with this, a laceration bandaging, if you had something just like a goose egg, you can always just apply not compression, but an ice pack or something like that. That's going to help let that blood provide constriction of the blood vessels and help that swelling to go down. So those are the two things you can do on basic, injuries to the skull or on the head. So if we have someone who's like hit their head, a rock hit him, a tree hit him, they fell down, something like that, it's a little bit more than just these superficial things. We're going to notice a decrease in mental status. Like they're going to just be a little loopier. A little bit more confused, but it's only going to be short term. Either they might even lose consciousness, but then when you go and try and do aggressive stimulation, which is like shouting their name or pinching them, we don't want to shake anyone with a head injury, obviously, for spinal precautions, but you're yelling at them and you can pinch them and you're still not getting aggressive or any sort of response, then that is considered more severe. But if you're able to wake them up, you're like, okay, they kind of like blacked out for a second, but we got them back, we're okay, then that's considered a mild head injury. They might also have short-term, after they wake up, they might have short-term memory loss, blurred vision, some nausea, headaches, dizziness, or maybe a little sleepy. So that's kind of the differentiation between mild and severe. We're going to want to treat any injuries they have. Obviously, if it's any sort of lacerations, we want to put dressings on them. And things. And then we want to give Tylenol for pain. We do not want to do ibuprofen if you can help it. It's considered partially a blood thinner. So more Tylenol if you've got that. And then we want to keep a close eye on them for 24 hours after their injury. This is where you get that thing like waking them every couple hours in the night. We're kind of just checking to make sure they haven't had any changes in their mental status. The thing with the skull is it's hard. And it has obviously your squishy brain on the inside with lots of blood vessels. And on the outside, it has just skin and hair. And so there's not a lot of like, if you get cut on your arm and it bleeds and you have like a bruise or something, that blood gets absorbed into your tissues and things like that. And the skull is very different. If you get a trauma on like the outside of your skull, that blood can swell and make a bruise or a hematoma, a goose egg. But that blood is going out because it can't go in, obviously, to the skull. If you have the same blunt trauma to the head and you have a bleed inside your skull, you can see where there's a problem that blood has nowhere to go. It's kind of usually a bleed will start to push because it can't push on that skull. It's going to start pushing down into the brain. And depending on where that affects your brain, what part of your brain that hit, you're going to start seeing these neurological problems with your person. So whether it's like vision issues or balance issues or speech or all these kind of things, just depends on where that bleed was in your skull. So yeah, so just keep a close eye on them for the next 24 hours. Now, if you've got a severe head injury, it's considered unconsciousness and they do not respond with any aggressive stimulation. This is obviously it could highly indicate serious brain damage. It may involve a skull fracture, and anytime you see a crack in the skull, that is considered severe. Obviously, I feel like you would think that already, but just letting that know. The way to tell this is a skull fracture is you might see a depression in the skull when you're like doing your patient assessments, and you're just kind of touching the skull and things like that, and you notice like a depression. That's concerning. Also, if you see a visible fracture, where the scalp has been torn away. So the skin has been taken away. And you also can see a fracture in there. Other signs of a skull fracture, you may not, like if it's under hair or something, you may not notice, it might be a hairline fracture, is they're gonna get bruising. They can get bruising under the eyes. That means we've got bleeding inside the brain. And so it's called raccoon eyes. Also, you could get bruising behind the ears. That's called Battle's sign. So when you're doing your assessment, be checking here and then always make sure you check behind the ears. We're watching for any that would indicate a severe head injury. And then if they have any drainage coming from their nose or ears, it's also something you want to be checking. Now, blood coming from the nose, that's something we want to watch and be monitoring for. If there is clear fluid, that is coming from blood coming from the ear. Clear fluid coming from either direction could be considered very severe, as it could be cerebral spinal fluid. Now the hospital has ways of checking that, the difference between that and snot, like hard. We don't have a way to check that really in the field. They usually will put something under their nose and that has a little chemical and can test I believe it's the pH. I might be wrong on that one, but they have a way of checking if that's cerebral spinal fluid. But just know as a guide out in the field, if you see that you're seeing clear fluid from the nose or the ear, that's kind of on your radar. And you're like, you know what? Let's take them in. We want to get them out of here and make sure they're okay. So be careful on that. Symptoms of a brain injury. So sometimes people may or may not have a skull fracture. They may look okay. And we've all heard these stories. So-and-so was out skiing, clunked their head, and then was dead like that night. And, we thought they were fine. So brain injuries are things that we need to be watching for. So when you're talking about waking someone in the middle of the night, checking every 2 hours, these are the things you're watching for, unless it's already presented immediately after the incident. We have a level of consciousness that's deteriorating. So if they have woken up, we're watching for them to become disoriented, and then usually irritable, and then combative, and then a coma. We had a brother that had a head injury when he fell out of a tree, and he started having seizures, and then became very combative. And, by the time EMS, the paramedics got there, he was fighting and combative. Those are all just signs and symptoms of head injuries, for sure. So you're watching for that change in their level of consciousness. And then their vital signs, their heart rate, if you check their pulse, you're going to find a slow bounding pulse. And then their respiratory rate is going to become erratic, fast, slow, shallow, labored. It's going to be all over, because that part of their brain might be affected that controls respiration. So that's just kind of your body just trying to compensate. Also, their skin can become warm, flushed, usually in the face area. They might have vomiting, of course. Visual disturbances that stay there. Like maybe I got hit in the head. Whoa, I saw stars, but now they're gone. That's different versus I've got hit in the head. I see stars or something, and they're not going away. That is when you really want to be concerned. And then of course, loss of coordination, like not able to walk. We're going to see something like someone bumped their head and now they can't hike out. They can't put on their pack. It's basic motor skills they can't do. And then of course, seizures would be a big sign for that. And then lethargy or sleepiness, if they're just like not able to stay awake, that's something that we're really concerned about. And then an increasing severe headache. And then if their pupils just are not the same, like one's big, one's small, things like that. That's something you really want to be aware of. So if you're seeing these signs of a severe head trauma, we obviously want to evacuate them as soon as possible. Now, a big caveat with this is making sure we maintain spinal precautions. But obviously, if somebody's having a bleed in their brain, we want to get them to the hospital as soon as we can, into surgery or whatever they're going to need to do, to likely surgery, to decrease the blood and the pressure on their brains. So we want to move them gently and maintaining spinal precautions if we need to. And we have a whole other training that we posted that we have on spinal precautions. So you can check that out. And then keep them laying down. And if you're possible to elevate their head and shoulders about 30 degrees, that's helpful as well. And then if the breathing becomes a slow and labor, if they're erratic breathing and you're thinking like lips are going purple, they're like, I don't feel like those respirations are effective, then you can start doing actual periodic rescue breathing for them. You can get in there and start breathing, every couple seconds, give them a breath, that kind of a thing. And then anyone who is not responding initially to the aggressive attempts at stimulation after they get blown to the head need to be immediately evacuated rapidly for anyone who has a severe injury, especially skull, and decreasing in mental status. So most of the time, if anyone's presenting any of these severe symptoms, we want to just obviously get them out of the way there as soon as we can. So just the big take home is be very, very careful. Head injuries, we're always watching for changes in consciousness. Once you manage the bleeding and things, you're watching their level of consciousness, watching vital signs, and just ability, coordination and things like that. And those can give you clues on whether things are mild or severe. So thank you so much for your training today, or paying attention and watching today. Do we have any questions at all from our viewers or anyone out there? If not, give me a thumbs up.
So the steri strips, they're kind of like, they've got a little tab on each side and a little thin thing in the middle. Am I thinking right?
Yeah, let me grab one. I've got one just right here.
Okay.
these are our first aid kits that we carry with us everywhere. There's a section in here, the middle section right here, and our steri strips are located right above, behind the scissors and things like that. And this is what they look like. Kind of blurry, but this is actually, if you look at them, I've got 1, 2, 3, 4 pieces of, so it looks like stringy tape. And if you open this up, they're like a Band-Aid where they have a split down the back, and you essentially peel off one side and stick those 4 pieces of steri strip on one side of the wound and use that and then secure it. And then you take off the other strip, just like a Band-Aid, if you were going to be super sterile, take off the other strip and then pull that skin from the other side closer to that with that laceration, and then stick these onto the other side. It's super slick. But yeah, you don't usually take one at a time. You're usually like taking the whole set, unless your incision's super, laceration small. But you can essentially take the whole set and stick it on. They're awesome, and they'll stay on for like weeks, so at least a couple of weeks, depending on if you're scrubbing and stuff like that. So great.
What about Neosporin?
I wouldn't recommend, if you have a bleeding head wound, consider that it's like bled out all the stuff. It's like that has cleaned the wound. You're at, in an emergency situation in the mountains, we're just going to apply dressing and wait till that stops bleeding, and then apply, and is dry enough to take the steri strips or the butterfly bandage. And then if you want to put, if you feel like we've got a ways to walk out or something like that, you can throw just a regular Band-Aid on there as well, maybe a bigger one. Just making sure that the taping part, the sticky part of that bandage is not sticking on the steri strips, because when you take that off, it's going to take the steri strips off with it. But don't worry about Neosporin or anything like that. I feel like it just makes things a little bit more complicated. And yeah, I would just keep a bandage on for a week. Talk to your doctor, but that's, as a hospice nurse, that's all I do. Great question.
Okay, good.
Yeah. All right. Well, thank you ladies so much for your time. Have a wonderful evening, and thanks for joining us.